Flu season, obviously, we're right in the middle of it, and you told us how we can avoid that and how we need to plan accordingly to try to avoid it and what we should look for, obviously. One of the things that's a hot button issue in the news, though, is Ebola, another form of sickness that everyone is talking about. And we discussed how the flu is contracted, how you get the flu. Is it the same for Ebola? What are some of the things that we should be worried about as far as contracting, actually getting the illness?
Yeah, this is a very hot topic, but it's not like the flu, so it's not a respiratory spread. It's a unique tropical virus. It's called a filovirus. That's the type that it is. So it's not spread by mosquitoes or ticks. This is a direct contact spread. You have to come in contact with somebody who has Ebola, and so with their secretions, either blood, sweat, vomit, diarrhea. So it's usually healthcare personnel who are the ones who come in contact with it, or family members of Ebola patients.
Okay, and then with that in mind, then, are they the only ones who are at risk?
Yeah, right now, they're the only ones that are really at risk. And so laboratory workers, anyone who comes in contact with, any of those body fluids and stuff, here in Germany, we are not at risk. Let me put everyone's concerns to ease. We're not at risk here.
And is that because it's not a place where we're ready just to deal with it, so they're avoiding it, or are we ready and it's just the decision has been made, we're not going to deal with it?
No, we're absolutely ready. I mean, we've trained for it. We've trained on all the protective gear. We're a military organization, so we've done tabletop exercises, patient flow, everything. If we get an Ebola patient, we are ready. We will evaluate that patient, but there's no plan to treat Ebola patients here at Landstuhl or any of our military treatment facilities in Europe. Those patients will all be transferred back to the United States for treatment.
Okay, and I was going to ask that because I'm sure the question on everybody's mind right now is: are we planning to, or are we going to treat people here in the KMC? And so you're saying that is not the plan; that they will be moved on to facilities that are already set up to deal with that.
Yeah, that's correct. I mean, we're prepared to hold patients and evaluate to do the testing to determine whether or not they have it, based on a temperature of 100.4 degrees or higher. Once a patient is identified with Ebola, they will be shipped directly to the continental United States for treatment.
All right, and you being from the medical side of things, and having that type of background, people can trust the things that you're saying right now, which are A, we are ready for it, correct?
Correct, absolutely.
And B, we're not planning on dealing with it. So I think you just heard a collective sigh of relief all throughout the KMC just now as you said that. So I appreciate your words on that, because there are, with any of these type of situations, there's a lot of rumors that float around. So putting those to ease. And another one that we started with was that it's not an airborne virus.
That's correct, absolutely.
Okay, so there you go. You can put your mind at ease about the Ebola situation. No matter what you've heard from your neighbors or the guy at the gym, you just heard it here from Brigadier General Van Coots, the commander of the U.S. Army Europe Regional Medical Command. So, everyone always says, be careful who you listen to. And there's the person that you should be listening to right there, telling you that we don't have much to worry about as far as Ebola goes, and we are ready to deal with it. Coming up, though, we're going to talk about another thing as far as health goes that we can do for ourselves. That's improving health